Daniel Rodriguez, and we're going to go sequentially until we're done. Then we'll have questions as usual. Thank you.
Thank you very much. We appreciate the invitation here, and let me give you a brief overview of what you're in for today. First of all, we're going to talk about a program that AARP has actually worked through for around 15 months. It involves informing people about two programs that on many levels is a part of our lives, Social Security and Medicare. So we're going to talk about it because, as we well know, the time has come for some action on those programs. Then we're going to spend a little bit of time talking about diversity in AARP. But we're going to talk about it in a way that is not traditional view of diversity, so that really could be kind of interesting. And then finally, we're going to have a representative of the Asian Health and Service Center, Gemma, who's going to talk about what that particular center does out here in Washington County. So it's nice to talk about Portland, but it's also nice to share information about what happens out here in Washington County. So that's where we're going to begin. And I am a volunteer. So I'm retired and I'm just loving it. But I work closely with Joyce DeMonnin, who is an actual AARP volunteer, and she can talk about what she does and what brings her here as well.
Well, I'm actually a staff member, but sometimes I feel like a volunteer because I work a lot of hours. And at AARP, we have a staff of 7 in Oregon. We have a membership of 500,000, and we have about 50,000 here in Washington County. So we have a lot of members here in Washington County, and people always say, it's always great to put a face with AARP because they probably get the magazine and the bulletin at home, and maybe they do or don't know what we really do. And what we really do is work on behalf of people 50 and older, not just retirees, to help people live with dignity, choice, and respect in the world. And we know our members are really interested in several issues, and the top one is always health, and then financial security and livable communities. And so those are the areas that we work on here in Oregon, either through education and outreach, and we have a full-time lobbyist in Salem who is working on behalf of you all. And we also have a communications person to help share the information. So today we're talking about a program called We Were to Say, an initiative called We Were to Say, because we know that behind closed doors, members of Congress have been talking about what do we need to do to strengthen, or maybe not strengthen, Social Security and Medicare for the future. And we think that people who've been paying into these programs all of their lives have earned a say in the future of the programs. And we know that in retirement, how many people can really live without Medicare and Social Security being there for them. So what this is all about is not just those of you who may have those programs right now, but making sure those programs are available for baby boomers, Gen X, Gen Y, and beyond. These are really valuable programs that people rely on to live a good life, and we want them to be there for all Americans.
If you think back to 15 months ago when we actually began this whole process, we knew that there was going to be this little thing called a presidential campaign that was coming upon us. Therefore, when we went throughout the state and talked about Social Security and Medicare, we attempted to do it in as apolitical manner as possible. We did not use R, we did not use D, we gave as many facts as possible. Because quite frankly, the people who receive Social Security and who've earned it, and who receive Medicare and they've earned that, are all political parties, Republican, Democrats, independents, non-affiliated, everything. And so therefore we didn't want to do that. As the campaign got closer, we did more presentations, and we were very, very careful not to talk about this hasn't happened yet, this will happen. So, guess what? The election is over. We told people that around January 2013, this January, some action is going to have to be taken. So now we're in that point, yet we're still talking to you folks about the particular programs, where it was. we had surveys of people throughout the country, specifically Oregon as well, and the people said a couple of things. First of all, is that they want their Social Security to remain. Okay, there's what it is. But their sense is that Social Security, to make it funding, as we'll talk about now, really needs a little bit of tweaking. There's not a lot of work to be done, a little bit of tweaking in Social Security. Medicare is another situation. Medicare is, as you'll see with some of the slides today, at best, it's a little confusing. And it's alphabet soup, as we'll talk about it today. But yet our goal in the short time that we have today is just to share with you some of the facts we have and to see what might happen next. So, here we are. This is kind of a crazy slide, but it's an interesting slide. People in Medicare, 38 million people in Medicare, 52 million people in Social Security. This is how the numbers have grown, both sides, over many, many years. Populations in millions here.
Okay, so just those of you who may not know this already, is that Medicare, first of all, is not free. There's a premium charged for a couple of the components in here. So when you turn 65, if you're already in Social Security, you're automatically enrolled in Medicare, and they take a premium out of your Social Security check. And for those of you on it already, you know that. So there's Medicare Part A that helps pay for hospital bills. B pays for your doctor visits. C is Medicare Advantage programs, and it's a way that you can pay an extra insurance premium and get a little different package of Medicare benefits. And then Medicare Part D is the prescription drug program.
How Medicare is funded. We have two separate slides, one for Social Security and one for Medicare that are actually pretty good. This is not the kind of slide that most people see, but this is very, very interesting. How is Medicare funded? General taxes, 42%. Payroll taxes, 37%. So those combined are a significant part of that. And then we have 13% premiums and other. And those are probably fees paid, and so that's what we have on those particular areas. Yes?
When you say general taxes, do you mean general income taxes?
Yes.
Okay, income taxes. Right.
So this is another slide I think people are really surprised by, is that when you reach 65 and get onto Medicare, a lot of people don't know that it's not free. There are a lot of costs associated with healthcare. And in fact, people spend about 17% of their income on healthcare-related expenses. For the average couple, once they reach 65 to the point that they pass away, they will spend somewhere between $200,000 and $400,000 on healthcare expenses. So even with Medicare, which is a really good deal and pays for an awful lot, maybe even more than some private insurance companies now pay, there are still costs associated with it that are out of pocket.
Okay, this is kind of a crazy slide, but it is interesting. You know, costs are rising, Medicare costs are rising because of factors such as prescription drugs, use of more technology, and different kinds of issues there. And so you have Medicare costs are rising. So you have here national healthcare spending has gone down to a certain extent right there. However, the inflation is going up. I mean, so those two are not meeting. In a perfect world, the cost would meet with inflation, therefore there'd be a zero-sum game. That's not happening with Medicare right now. We're spending more than we need to on this particular area.
I might just add that Robert Reich, a lot of you know who he is, he had a column recently where he said the problem with Medicare is not Medicare, it's the cost of the inflation in healthcare costs. And we're all paying more. As you know, if you're a worker, you're paying more and more and more every year for your healthcare premiums. Well, the Medicare benefit has stayed pretty much the same, but the healthcare prices keep going up. So what we're trying to look at is how can we really do a better job of reining in the inflationary aspect of healthcare? And there's a lot of really good work about that if you want to talk about that. It's sort of a different topic. But so Medicare challenges include that within 12 years, the Medicare Trust Fund is running out of money. And of course, the government can always pay for that, but we are looking at a challenge in the Medicare budget taking up more and more of the federal budget. And this shows you where our available trust fund funds are. Yes?
Does this take the new healthcare bill into account? Does it reflect?
This slide is pretty current. It's only 6 months old, so it does take the new healthcare bill into account. It's a projection, and so whether or not the healthcare law can actually rein in spending even more is wait to be seen. But we're all hopeful that with Obamacare, which we now fondly call it, passing and being the law of the land, it will actually help reduce healthcare costs.
The question was, and we'll try to repeat the question, is that does this particular slide reflect what experts think the Affordable Care Act will involve? And the answer at this point, yes, it does. Okay, here we have an interesting one. The number of, we are, as in Social Security, we are retiring earlier, we are living longer. Fewer people are paying into Social Security and Medicare. So those three combinations are not, from a business standpoint, is not the best thing going on in the world. And so something has to happen. And so here we have number of people in Medicare expected to double between 2000 and 2030. So that's a lot of people. We, on many levels, I have retired. Joyce dreams about the time when she can retire. But we are there, and so that's what's happening. We're having more people retire into the system than we have had since the program began.
So along with the number of retirees and the cost of healthcare, this is just a slide that graphically shows you the expected increase in Medicare spending to 2021. So it's almost doubling. So it's a big bunch of money there to look at.
Okay. Was there one before that?
That was the one I did.
Okay.
Oh, maybe not. Okay.
Okay. All right. We're going to switch gears real briefly because again, we have sat in and had presentations made to us on Medicare that were 3 hours long. Be thankful we're not going to give you a 3-hour presentation on Medicare. We're going to switch over to Social Security because remember, and I'll repeat slightly what I said earlier, most people who took the survey in Oregon said that Social Security needs some minor tweaking. We're going to talk about some of those minor tweakings right now. Social Security, who is eligible? Social Security is an earned benefit. You need to work at least 10 years to become eligible for Social Security. You need Social Security credits when you work in a job and pay Social Security taxes. Okay, so it's not as widespread who is receiving Social Security as you think. No, you need to pay into it, and you have to pay into the Social Security.
So a lot of people, when they talk about Social Security, think about it as maybe those retirees or who are these people. But as you can see from this pie chart, that a lot of people are getting Social Security besides older adults. We have children whose parents may have passed away, they're getting a Social Security benefit. People with disabilities are eligible for Social Security. And then widows and widowers also get it. And so, we have a wide range of folks who are receiving Social Security benefit. And really, if you think about it, Social Security allows people to live in dignity. It gives them a benefit that they can live on. It's not very much, but it's something that they can live on. And it's a great program that really serves a lot of Oregonians.
It various times when we've given this presentation, there are many, many women in the audience who want to know where can they find this particular model, this guy on there. So,
He's a construct.
pardon me?
Construct.
So about half the seniors, Social Security is a vital source of income. We actually, Joyce distributed to you a fact sheet that is very, very interesting, and it may be time for us to talk about some of those things right there. In terms of what I think, one of the interesting things about it is that within the state of Oregon, 36%, well, the seniors, the people receiving Social Security, keep 36% of the Oregonians out of the poverty level. I mean, so Social Security provides a very, very significant amount of funding. Otherwise, people would be at the poverty level, which begs the question, what is poverty level? On many levels, if you're a single person, that's around $18,000 to $25,000 a year. So Social Security will keep those people out of there. Clearly, if you're a family of 3 or 4, that amount goes up. But you need to have some idea that if you are a single person, it's around $18,000 to $25,000. And so the various things are where we are there. So Social Security provides 50% or more family income for more than 1/2 of all older Americans. That's an incredible statistic on the value that Social Security provides to people. And then Social Security provides 90% or more of family income for 1/4 of the seniors. You know, I mentioned that my mother's a good example. My mother, who lives by herself in California, she's 86 years old. Her Social Security provides 90% of all the money she receives. I mean, so there she is right there. And so there's my mother on that last bullet right there. That's how important Social Security is to people.
So my mom has passed away, but she was also one of those folks who relied on Social Security her last, years of life. Because when my dad passed away, he had a pension and he had Social Security, and they had a little bit of savings. And she had her Social Security, and when he was gone, his money was gone, and she was left with that was the only check she had. But because of Medicare and Social Security, she was able to live in her own home until almost the very end. So it's really, I think a lot of us, we think about our loved ones and how much they rely on these programs. But I think about being in this boomer generation where my parents relied on this so much, and how I want the younger kids in my family to have the security to know that this program is going to be there for them. So it's funded primarily out of payroll taxes. And I think that's one of the reasons that I personally feel so strongly about this program is it is paid out of payroll taxes. We have earned this benefit and we deserve it. So it is a social insurance program. So you don't have your own little savings account like you have a 401k. The money goes into the Social Security Trust Fund, and it's available for people who need it. And so if you passed away, it's like any other insurance, you wouldn't be able to receive it. But then if you live to be 100 years old, you won't outlive your money. It will always be there for you. So it's a wonderful program. It also receives part of its money from interest. And Social Security is invested in Treasury bonds, which is the #1 safest investment in the world. The same kind of investment that China makes into America. They buy Treasury bonds too. So if you had $3 trillion, which the Social Security Trust Fund has, you would want to make it work for you, which it is doing for us. And then there is a small amount of money that comes out of taxing benefits.
For most of you who are still working and you have your monthly check, and we talk about the 82% from payroll taxes, that is the FICA taxes that you get on. That's what that is. And so people have joked with us is that that's the new 4-letter word. The FICA, that is the taxes that you pay. And so how we go, actually we'll get into that quickly. Go ahead.
Okay. So this is just another graph to help show you what the situation is that we're looking at. We have full funding, actually that slide needs not updating, we have full funding until 2033. After that, people always talk about this huge crisis. Well, it is a crisis, but still, with payroll taxes, it can still continue to pay 77% of benefits, primarily about 77% of benefits on through forever. So it's still a good benefit, but we could just make small changes, sooner the better. We could have the full benefit going on and on and on.
In a 65-year-old could expect to live nearly 20 more years today. When Social Security, and actually as of 25 years ago, I think in 1940, a 65-year-old could be expected to live 12 or 13 more years. Now, that 65-year-old is expected to live 20 more years. So again, as with Medicare, particularly in Social Security, we're going to live longer. We're going to go visit the gym. We're going to walk. We're going to keep ourselves in shape. Therefore, at the same time, we will be collecting Social Security longer. So we talked about some of the shortfall. That's one of the issues befalling Social Security at this particular moment.
And we all know that the birth rate fell. A lot of folks in the county are baby boomers, and baby boomers didn't have as many kids as their generation did. So the birth rate's gone down, and so the number of people paying into Social Security will be equalizing to some degree. We saw that population pyramid at the very beginning of the presentation. That looks more like a column nowadays than a pyramid. And so this is another of the challenges that we're looking at. It's not an insurmountable problem, but it is something we need to look at.
Right now, actually, in the political arena, while we don't want to discuss the specifics, one of the issues on the political arena is, can the two parties work together? Can't there be a compromise? Can't there be anything like that? And so far, we haven't gotten too many encouraging reports that they can. So let me share with you something that historically is one of the bigger instances of the Democratic and the Republican Party getting together and working together. And this occurred in 1983, when President Reagan and a Republican, Tip O'Neill, a Democrat at the time, they got together and adjusted the Social Security computation device, the formula, so that then they could alter, make it more reasonable for the number of people retiring and the longer left. So that took place in 1983. I'm sure at some point we look forward to 2013 and hoping that at some point a similar compromise will occur. We don't know, we hope, but there's a good example of a compromise.
We have a legislative director in Washington, D.C. who likes to answer a lot of these people who are like, oh my gosh, this is terrible, this is the sky is falling with Social Security. And saying, the thing with people turning 65 is that we know how many people are going to turn 65, and we've known it all our life. We knew from the day the big boomers were born how many of them are, and on average, how many people live to be 65 and older. We have data about this. It's not a surprise. No one's surprised. They've always known. And so back in '83, as Daniel said, a compromise was made to strengthen Social Security. We need to make a small adjustment to strengthen it again. We can do it. We've done it before.
Joyce, does AARP recommend any particular fixes?
AARP at this time is not recommending any fixes. We want to listen to the public and get everyone's opinion. And so you set me up perfectly, because if you would like to share your opinion, you can go online, www.earntosay.org. I think .com also works, or you can call this 1-800 toll-free number. So this is a chance for you to make your voice heard, and we are collecting millions of people's opinions, and then we are redistributing them back to members of Congress. And we are finding out, as Daniel said, that people want their voice heard, that they want to be considered in the debate, that they're not just another number, these are human lives at stake. And if it's important to you and you want to get your voice heard, you have a chance to do that through this website. And we will get your opinions into the mix and make sure our members of Congress know what you think.
We're going to shift gears real briefly. Thank you, Joyce. One of the things we learned in this particular election, again, some people were related, other people were depressed, is that the demographics of the country are changing. For good, bad, or indifferent, they are changing. 2 years ago, that potential prompted us in AARP to begin what we called a diversity in aging, a bilingual diversity council, to find out what it was that was going on in the state. You're going to get a chair there. Okay, let's go ahead and show you some of the things that we found out. First of all, in less than 20 years, Oregon's 65-year-older plus will more than double, growing by over 137% to include all Oregonians. Once again, telling us what we knew both on Social Security and Medicare, we're living longer. Okay. Or the 2010 census results, total population. This is not necessarily news at 11 to you folks, because look where the population, right there. And it goes basically along the I-5 corridor down. Okay. By 2013, we estimated there will be 7 LGBT. Who knows what LGBT means?
Yeah.
Yes.
Lesbian, gay, bisexual, and transgender.
Lesbian, gay, bisexual, and transgender. Adults reaching retirement. In Portland, there are about 8.8. Okay, again, some of you will feel happy, others depressed. That's what's happening right now in our world. Okay? Racial ethnic minorities make up 1/3 of the U.S. population. This will grow by 54% in 2015. Again, we're getting infused with a diverse population. African American population, 65%, 65 years and above, will grow to more than 10.4 and accounting for 12% of older adults. And Asian Pacific and Pacific Islanders. Again, if you think about it, prior to some of the censuses that we've taken, these terms were not even used. Every time we have every 10-year period when we have a census, more labels come up for a growing level of population. They will account for 77.8% of the population. In less than 20 years, the Hispanic 65 and above population is projected to be the largest racial minority in this age group. The Hispanic/Latino. One of the issues going on is, do you call them Hispanic or Latinos? For them, this is where the population centers for the Hispanic and Latino groups are within the state. Look over here on this particular corner. If you remember our first slide, very few, perhaps some of the lowest population in the state was over in that corner, and yet it still is predominantly Hispanic and Latino over in that corner of the state. Okay. Population breakdowns by county. Okay, let's go with Washington County, right there in the middle. That's where we are today. Okay, we have multiracial 3, Native American 0.5, African American 2, Asian American 9, Latino 16%, white 70%. Still a significant majority of white, Anglo, whatever term you want to use. Those numbers are going up. Look at over on the left side with Multnomah County, clearly our most populous county, 72% white, 11% Latino, Asian American 5 and 1 and 4. Okay. Now, here's what we did. Here's what AARP has decided to do. We're trying to involve more people. However, I need you to talk about or I'll share with you some information that surprised us. Okay, I'm 63 years old, I'm a boomer. Okay, so I know, so when, as a boomer, as a 60 plus, and probably 55 plus, when we talk about diversity, by and large, we think of color, the color of our skins. That's what we do when we think about, I mean, that's the nature of 55 and above. You ask the same thing, diversity of 20-year-olds, and they have an entirely different view. 40 entirely different view. That's what's happening. There was an issue in the state legislature last year on cluster mailboxes. And I'm thinking, here I am talking about diversity in the state of Oregon, and they're talking about cluster mailboxes. And I'm thinking, okay, what the heck does cluster mailboxes have to do with diversity? It actually began in Bend. And the issue is that now most communities don't have single mailboxes in front of their home. They have cluster mailboxes on the corner where they've got 25 to 30 or 40, however many they have. The issue of cluster mailboxes was made public because most people who are on a walker or who have a motorized device cannot access those because there's not cement or firm footing around it such that they can't access it. So it became a diversity issue, and the diversity population were the handicapped who needed a walker and motorized vehicle. So we then had one more definition of diversity in the state of Oregon. We then had the GLBT. That was another one, becoming a significant force in the state of Oregon. Yet something else that we boomers probably didn't really know about. And again, depending upon how you feel, one of the more significant groups in the state of Oregon are the gay and gray. People our age who have decided to come out and who are gay and lesbians, and they are now becoming a political force. So now we have a diversity issue in the state of Oregon that goes beyond simple color of skin and races. And so for good, bad, or indifferent, it's still having an issue. And one of the issues, the cluster mailboxes actually work this way into legislation. So did you have a question? Okay, no. So I'm just telling you because one of those things is that we boomers are still learning new things as we grow older. You know, where it's going to happen, and 20 years from now, someone else is going to be up here at this microphone talking about the awarenesses of diversity, and Lord knows what information they're going to have at that particular point. Okay, we're now going to switch gears again for the third aspect of our information to Washington County. I wish to introduce Gemma Kim. Gemma is a Korean who is a bilingual licensed social worker and also a registered nurse. She received her bachelor's degree in nursing at Oregon Health and Science University in Portland in 1989 and a master's degree in social work at the Portland State University in 1995. She currently works at the Asian Health and Service Center in Portland. However, we'll talk about the same organization and facility here in Washington County. So I introduce to you Gemma Kim.
Hello everyone, thank you for inviting me, and thank you Joyce and Daniel, including me in the presentation. And I'm going to skip some of the slides because Daniel and Joyce already covered some of the statistical data. So I'm going to go ahead and quickly get it. Actually, due to the time strain, I'm going to just review. Can I plug the microphone, please? Okay. So I'm going to skip some of this statistical data, and as you saw, the Asian population is growing, and it keeps growing. And the Tri-County area also, that Daniel already mentioned, that Washington County, about 9% of Asian is going. And so I'm going to just to show you a little bit about our center's data. That languages spoken by clients, and you see that we cover the clients who speaks Cantonese, Mandarin, Korean, Vietnamese, English, and others. And we have the Cantonese speaking and Korean speaking is most dominant folks that we serve. And then birthplace of clients that we serve, they come from China, Hong Kong, Japan, Korea, and Taiwan, and Vietnam, and the other area. And the client's county composition, when we look at it, that Washington County, we serve about 36% of people that we serve. And this really tell you that how many Asians living in Washington County area. And I'm going to just tell you a little bit about our center. And our center has been established in 1983, and we have been serving the community for the last 29 years. And we provide service for culturally specific approach to help Asian immigrants adjust to the new culture, access health services, participate in social activities, and connect to their cultural heritage. And our mission is to bridge the gap between Asian and American culture in the efforts to build a better community and harmonious community. Our vision is to reduce health disparity and increase access to high quality health care for all Asians. And we provide services, community engagement, public health, behavioral health, and we have an emergent preschool in Poland area, not in the Beaverton. And the community-based participatory research, we have been doing colorectal cancer research and also breast cancer research that really study for Asian community. And the community engagement program that we provide a lot of cultural celebration and activity, social activities, and include the Chinese opera, Tai Chi, dance, and it's really fun. And you're all welcome to join, actually. And that's our community engagement program. And the public health program that we really focus on the prevention. Daniel mentioned about the healthcare cost is rising, and right now we are facing a lot of funding shortage. So our center is really trying to working on the health education, and we integrated with the Chinese medicine clinic, naturopathic clinic, and we bringing a lot of partners in the community. And so we provide more prevention and education. And the behavioral health program that we have bilingual, bicultural, state-certified professional contract psychiatrist that who provides linguistically, culturally appropriate mental health services. And we provide the Tri-County area and outpatient mental health program for the Asian community. And emergent preschool is we provide the bilingual preschool for the children who wants to learn the culture. And so all the program is operating and teach them with the Mandarin. And we see a lot of American children attend that class. And we have a community-based participatory research that we partnering with the PSU and OHSU, and we are really working with the Education Teaching Institute and partnering with them. So we provide the research data and really help the healthcare provider to deliver the effective and cost-effective services. And we have these 4 values, and we have these 4 values: engage, empower, enable, and encourage. And engage is through the social activity, we help them to engage. And then empower them, we really help them. And many of our service recipients become volunteers. So they receive and they give at the same time. And we really empower them and trying to provide service based on the strength. And enable, and we're trying to really help them to providing the employment services and trainings, and that really help them. And encourage them to seek help when the problem is not really getting severe. So prevent them to go to emergency room. And so we really encourage them to increase their self-care. And so I'm going to just show you a little bit about the services that we provide in the Washington County. And so I'd like to introduce just 2 programs in the community and senior program. And the community and senior program, we provide information and referral services, and women health promotion project, and Asian Family Caregiver Assistance project, and Helping You, Helping Me project, and Asian Wellness project, and also weekly community groups. And I'd like to share this photo. This is 2012, last August. We have this the health fair every year, and that was our 11th year's health fair. And these folks are all the volunteers, community volunteers, and the staff who's participate in the event. And this is the photo that I like to show you, that it's a community engagement that we just celebrate the, actually I've been working with the center for the last 10 years, and we have this celebration. And this was inside the Beaverton Resource Center. And this photo is kind of interesting photo that I like to show. This is what we call Anabada. It's like exchange goods. The singers come to the weekly group, and they bring the unused or unwear their clothing and household items, and then they do the exchange. And then they are so excited and they're so happy. And then after the program, whatever is left over, we bring them to the Goodwill and donate it. And we do this seasonal basis, and it's become very popular and very good program. And Women Health Project, we provide a woman over age 40. We help them to connect with the Oregon State Breast and Cervical Cancer Project, and help them to connect with the services. And we provide the service from starting to the end. End means follow-up. If anybody find any problem, then we really help them to connect with the services and provide the treatment, and then case management, counseling, and then also the support group. And we do a lot of community education. So we have groups running in the Beaverton, Korean, Chinese, and Vietnamese groups running in the Beaverton. And every 3 months we have different topics. And these are the programs. Some of the programs we invite guests from AARP and from the Washington County. So we invite a lot of guests, and so our seniors know what's going on in the community. So we try to do it as like a bridge. And the Asian Family Caregiver Assistance Program that we provide service to the family caregivers and consultation, counseling, referral, and the powerful tools for caregiver classes in Korean and Chinese. And the case management services that we connect them to with the paid caregivers, and it is one of the challenging, really find the bilingual and bicultural caregiver, hiring them will be very challenging. So we are helping. And this is the Korean powerful tools for caregiver classes that I was running, and we're really grateful to have it's good support from the center. And I'd like to just introduce you the Helping You, Helping Me project. This is the project that we got funded, and it is the recruit in-home caregiver who wants to be a caregiver. And then we provide the training, and then we help them to connect with the family caregivers who want to hire, and we help them to interview the caregivers. And so we kind of help them to connect with the paid caregivers and the family members. And this is the picture that our staff who's doing providing the education for the paid caregivers who want to be getting a paid job. And we have Asian Wellness Connection, and we are trying to connect the dots. Like I'm the client, I don't know the English and I don't have the PCP, then we're trying to help them to connect with the services. And so due to the time, I'd like to just say a little bit about the weekly community group. This is happening in the Beaverton. We have many, many more groups happening in Portland, but this is the program that we are running in the Beaverton. And Monday we have Oriental painting, Tuesday Vietnamese senior group, Wednesday Mandarin group, Thursday Oriental medicine and Oriental painting, and then Friday senior group. So we are pretty busy, and that's the yeah. And then the behavioral health program I already covered. And then some of the barriers or limitation to health and community services is most of our population that we serve, they are monolingual. They are not, their English proficiency is very low. And so we serve them with our own languages, and so the language barrier is really prevent them to the access services. And I really encourage our folks to join the AARP, and so maybe we need to work on. And the cultural differences in health beliefs and preference, and then limited resources and funding. And we really have limited services in Washington County. We do have some fundings from the Multnomah County, but the Washington County, we have very limited services. And you know, as I shared before, we serve a larger population of the Washington County folks, but due to the funding shortage, we like to do more. So I need your support. And this is our Beaverton office. We are located inside the Beaverton Resource Center. It's Allen Hall. It used to be a Beaverton library. I thought there was old library. And our operation hours Monday through Friday, 8:30 to 5. And we really welcome you to visit our center. And then we do a lot of cultural celebration, Chinese New Year, autumn festival, mid-autumn festivals, and all those celebrations. And you're all welcome to join. And also we have Oriental painting, and you're welcome to come and teach you how to do the Oriental painting. And our service is very minimal cost, and most of them are free services. And so, you know, I really appreciate this opportunity, and thank you for your attention and giving me this opportunity. And thank you.
members of the forum may ask questions of the various speakers. We've got 10 minutes. Ask away.
Patrick Wheeler, forum member. I've got a question for the AARP people. We've had a major financial problem in this country. You sit there and you point out the problems. You haven't offered any solutions, and you say, yet on the other hand, there's going to be just minor tweaking, but you don't say what those are. I think being disingenuous to that in the discussion in this country that we need to have on how to fix Social Security.
Is this on still? At the back of the room, there are some booklets that explain the top policy options that have been considered on the table. And they have been vetted and organized by the Heritage Foundation and the Brookings Institute. So we have bipartisan, a conservative and a Republican. You can also go on earntosay.org where all that information is available. So that information, the lawmakers are the ones who are going to come up with the solutions. We need to say what our opinions are about them. You can get all that information on the back of the table. So we have the information available. We're spending a lot of our time and resources making it available. It's up to you now to access it.
And let me get a little bit into the weeds with one of your issues right there. Okay, a solution. We showed the slide where 80-some% of Social Security is funded by the payroll taxes. Currently, the top level of payroll taxes is approximately $112,000, $113,000, meaning that if you make anything under $112,000, $113,000, you pay Social Security taxes the entire year. If, however, you make anything above $113,000, the point during the year at which you achieve your $113,000, you stop paying into that. So that funds it. So one of the proposals is to raise that $113,000 to approximately $200,000. So if you're making up to $200,000, you will pay the entire year. That move from $113,000 to $200,000 will fill that gap around 80%. So that's just one of 5 or 6 proposals, and 6 of the proposals are detailed on one of the brochures that we have in the back.
And we're giving away for free.
Chris Leslie, forum member. Franklin Delano Roosevelt started this Social Security with the idea of helping the indigenous, the really poor. And that was the main idea. Then Johnson glorified it with expanding to cover everyone, or practically everyone. But in a sense, isn't this a real pyramid scheme? Because the more people in the workforce are paying in to support lesser people on the top.
Lesser people on the top, I don't understand.
You have a growing workforce with immigration, everybody coming into the country.
Correct.
We have people that are hired paying into the system. That increases the number of workers who pay into Social Security, which in a sense funds the people at the top of the pyramid.
Oh, well, people who receive Social Security benefits are not at the top of the pyramid. They're Social Security.
In age, I meant.
Well, yeah, but it's not just age. It's age, people with disabilities, and children. And so I don't know which one of those groups you don't want to take care of. But, in Social Security, it was originally designed as...
For indigenous
No, it was
people that are
originally designed as a retirement supplement. As a retirement supplement for all Americans. And it has been expanded for all working Americans. You have to pay into it to earn it. And that's still the way it is now. You have to pay 40 quarters in order to become eligible for Social Security. And it is self-funded through payroll tax. And as you saw on the slide, even if we hit that point when the trust fund is depleted, it can still pay 77% of benefits with no changes. And one of the options that Daniel mentioned was raising the payroll tax so people at the higher income bracket pay the same proportion of their income into Social Security as the rest of us do. The other ones, there's a lot of other proposals out there which can include things like reducing some of the tax breaks that people get for things like their health savings account, things like that. Extending the retirement age, so like in 1983, part of the grand bargain was instead of getting your Social Security benefit at 65, you would be 66 or a little bit older. So there's a proposal now, well, people are living longer, maybe you should be raised to 68. But it's not, we're not at the point right now where we're weighing in on the argument because we want the public to ask these questions and think about what they think is best for themselves and the family and the country.
I'm Barbara Wilson, a member of the forum. I heard you say, and I saw the slide, that healthcare costs are increasing faster than inflation. And I had heard that before, so I wasn't surprised. But do you know, is there a particular part of healthcare costs that are driving this? For example, are premiums on your insurance policies, are they increasing, or what's the cause of this?
Well, it's a complicated answer, but I will take a stab at it. What's causing the cost of healthcare inflation? A lot of it is we have a lot of new high technology that is really fantastic, but we also have biological drugs, which are very, very, very expensive. And the cost of all of our new technology and some of the new medicines we have that really enable people, for example, cancer to become a chronic disease instead of necessarily a death sentence the way it used to be. These are some of the drivers in healthcare inflation. And every time you get new equipment and a new wonder drug, it's expensive to pay for. And so healthcare premiums are just keeping up with some of the costs that people are paying to cover healthcare. And as the population gets older, people who are over a certain age tend to need more healthcare expenses. So inflation, and typically the cost of prescription drugs is the highest point of inflation, has been for the past several years as a driver. So the cost of drugs, the highest inflation factor in healthcare.
Lee Coleman, forum member. I noticed that in this whole discussion, way beyond AARP and other advocates, nobody ever talks about the real beneficiaries of Social Security, the real constituency for protecting and enhancing Social Security and arriving at all of those options that we ought to consider. So does AARP have any data on who benefits? Grocery stores, doctors, water companies, landlords. What data have you got? You got a slide for us?
I don't have a slide for you, but we did hand out a fact sheet that really shows how Medicare, Social Security are huge economic drivers in the community. And I don't have it in front of me, but it's bringing in a lot of money into Oregon. And I think a lot of those communities, I think you're making a very good point, because if something happened to Social Security and all of a sudden seniors couldn't pay for rent, and they couldn't get care, and they couldn't get health care anymore, where would they be going? They would be going to your county government for help, right? And I think somehow part of that conversation needs to widen up so we include our county officials, because people these programs are enabling people to live independently with dignity. Without them, they're going to be still these people who need services and help. Instead, they're going to be in their community, maybe accessing the Asian Health Center. So I mean, I think we're looking at this, so it's a really good question. And the information we provided to you does show some of the economic factors of how important these programs are to our economy here in Oregon.
Thank you. We'll continue questions after the television goes off. Washington County Public Affairs Forum is a public spirited body who meets to bring the ideas in the community before the community. and you can be a member fairly cheaply by contacting us. And thank you for your time. We can continue the questions, but the television is going off. Thank you.
I want to make sure you get this brochure so you can see them, because they're pretty good.
And I have one, Bruce Bartlett, forum member. I have one fairly direct question that might have a big answer.
Bruce, we have a meeting, the marketing committee after the meeting, so anybody has marketing ideas can meet back there. Go ahead, Bruce.
Okay. We talked about living independently, and while I'm interested in that subject, I'm also interested in living collectively, so that in assisted living is kind of a pseudo collective living environment, but it's still individual. I think that living in community does a lot to strengthen a person's psyche, and you sustain each other. Are there models of collective, of elders in collective living situations more than just your normal assisted living environment that would give us some hope for the future?
Well, you know, there are some really good models. The most famous one is the Beacon Hill model in Boston, where this group of people, basically it's a concierge service, and you all live in a building, for example, and instead of paying each person looking for their own carpenter, plumber, whatever, electrician, they all work together to hire one person to service the building. But there's a whole bunch of collective opportunities like that, and there's some work going on in East Portland right now, and it's referred to as the village concept, and so you could actually Google that and find out some information. But it's exactly what you're talking about. People coming together and living together, maybe not living in the same building, but in the same house, but having maybe an apartment building, or, you know, people always refer to that area by Chute Park as a naturally occurring retirement community, because people have been aging in place over there, and all the neighbors know each other, and they kind of look out for each other, and that's part of the whole thing, is this whole idea of building community and getting to know your neighbors. And so when they need help, you help each other, and that's part of how you build a community.
One of the major issues for AARP in 2013 is a program called Livable Communities. So we can provide you the name of some people, some staff members with whom you can communicate and jump into that, because clearly that's going to be the wave of the future. That the series of independent single-family homes, while nice and looks great, is probably going to devolve into some sort of community living.
My concern is that we're building single-family homes at the same ferocious rate as we've always done, and some apartment buildings, but with, you know, the getting up down the stairs issues amongst others, we aren't building housing for elderly people. So.
We can't argue with that.
Okay. Yeah.
We can't argue with that.
So that's a good place to look at some activism.
Good. Thank you.
John Hussler, forum member. I wonder if you could speak a little bit more about the AARP's diversity program. You talked about you know, new categories of diversity, but what is AARP doing in
Well,
that area?
actually, what we're trying to do, and that's interesting, and let me take it with two of the most popular and successful programs within AARP that most people don't even know about are driver safety program and tax aid. Driver safety program will allow you to take an 8-hour course and to get a discount from your auto insurance company. That varies. I'm not going to say here that it's 10, 12, 3 to 4. It varies. But see, that's an area where the instructors are from AARP. Every county in the state has that program. Okay, the next program is tax aid, which clearly within the tax window will probably start again starting January. And it is the largest volunteer tax preparers in the country, and it's overseen by that organization called the IRS. And so it is there. So with that as a background, our involvement, one, is to try to access the various groups, diversified groups in the state of Oregon into those programs. We know it's good. We almost operate on the what's in it for me. Because a lot of groups will say, yes, we know we belong, but what's in it for us? What's in it for you folks, you member of a diverse group, is we can help you with your taxes, we can help you with your car insurance. So we're trying to get more involvement from that. And so that's the impetus to involve more people in the services provided. Okay.
Sorry, is it essentially an effort on the part of AARP to broaden its membership to these minority groups?
Well, it's yes and no. We are already the largest membership organization in the United States.
I guess what I'm asking
right.
is it disproportionately white at the moment and
yes,
trying
okay,
to do
okay. Yes, it is disproportionately white. Right. That is very, very true. Thank you for being so blunt. And I could have answered the question. So yes, we're trying to engage that group. Yes. And where we go, where we speak all over the state, like we do not have applications to distribute to the folks and say, for $16, you too can do this. We don't do that. And so that kind of takes, we're just trying to provide what we can. Oh, do we? Okay.
However, we have more minorities as members of AARP than any other organization does in Oregon. Even though maybe we're still looking, because we want to reflect the population, we have a lot of, because we do have all that demographic data available on our membership. So.
I heard you say that Social Security is funded by payroll taxes. Did I hear that right? Okay. Over the last 2 or 3 years, Obama has been cutting payroll taxes as a method of stimulating the economy. And every time I heard that, I wondered, is Social Security funding being jeopardized by these payroll tax cuts? Can you explain that to me?
The short answer is yes.
Oh, no.
Yes. And in fact, some of the, is it tax-free holidays? What is the tax-free holidays? AARP has taken one of its few stands and said, we oppose that because it adversely affects the funds on the Social Security side. So yes, you were right, and yes, it does.
Although Congress has promised to make up those funds. They have, but I don't know,
Oh, politicians fund.
I know.
Yeah. Thank you again, folks.
Thank you.